All right, welcome to the June Aging in Place Forum. This is the Healthy Lifestyles Lead to Successful Aging. Just some exciting news to let you guys know. Last year's Aging in Place Forums, the 2018 series, won an award, a national award from the National Association of Home Builders. Clap for that. Carol Bonesack from our Greater Iowa City Area Home Builders Association submitted the nomination for the award, and she's going to be going out to Baltimore next month to pick up the award. So we're going to get all sorts of pictures, I hope. Excellent. But we won for Best Public Relations Program. So that's a pretty awesome thing to win a national award off of something that the Housing Action Team just created last year. It feels like out of thin air. I want to thank the University of Iowa Community Credit Union for being our sponsors and taking care of lunch for everybody here today. One little note, just so people know, if anybody has questions during the course for any of the speakers or at the end when the speakers are done, we do have a microphone that we can pass around. We'd like to get that microphone just because City Channel 4 is gracious enough to tape all of these, and would love to be able to get that question picked up on mic so that it can be understood from people watching this later on that couldn't be here today. So let's get this thing going. The Housing Action Team, so this group is through the Johnson County Livable Communities. Livable Communities is an initiative of the Johnson County Board of Supervisors. Housing Action Team is one of the groups underneath the Livable Communities initiative. This is an awesome action team. Really proud of all the work that they do, obviously winning national awards. But it's a collaboration. Well, you can just kind of see this is what the Housing Action Team strives to kind of do, is work on affordability, accessibility, universal design, home safety, availability, and housing options. And some of the big members are of course, Livable Communities, the Greater Iowa City Area Home Builders Association, and the Iowa City Area Association of Realtors. And we always thank them for allowing us to have this space to do these forums. It's a great place to be able to do it. Here's a picture in time of many of our members. We're thankful to have those big organizations involved, but there's a number of volunteers from many organizations. This is just kind of a sample list, and I know it may be hard to see all that on there, but these forums just don't happen without all of the collaborative efforts from great volunteers in our community, pulling great ideas of topics of each of these sessions, getting the speakers all lined up. So big thanks to them. And that's the end of what I have. So what I'm going to do is I'm going to get Lorraine up here. Oh, Dave next. All right. Lorraine's going to come up here. Lorraine Ballons, one of our members from our Housing Action Team, and then she's also a policy board member on the Livable Communities.
Can I say we're looking for volunteers?
You can say that.
Okay. We are also looking for some volunteers to serve on the committees, so if you feel inclined, let Jeff know. He'll take it over. I'm Lorraine Ballons. I'm board member on this committee. I'm also on the Housing Action Team. I'm relatively new. I've been on the board about a year and a half. It's my pleasure to announce Tara Mesher, who is a nurse practitioner with Mercy One Towncrest Internal Medicine. She's been a busy woman in her career of over 25 years. She is an ARNP. She got her Bachelor's of Science in Nursing from Mount Mercy. She's worked at St. Luke's for 13 years in cardiovascular medicine surgery, general surgery, and hospice. She worked as a hospice nurse for 3 years, then went to University of Iowa Hospitals and Clinics as a critical care float nurse for 8 years. She worked full-time while attaining her Master's of Science in Nursing for Adult Gerontology, Acute Care, and Family Nurse Practitioner at Allen College. She's board certified in all of these areas. She's worked in gynecology, oncology, family practice, and internal medicine. Plus, she's married and has 4 children on top of this. I don't know when she has the time. I'm exhausted just reading this. But she's really active in the community and once in a while gets to sleep. So thank you, Tara, for coming up. And she's going to give us some helpful hints on how to age and age well.
Hello, everybody. Thanks for coming today. I want to thank Lorraine for finding me. She made a phone call to Mercy and said, hey, we've got this thing going on, and would you like to participate? And I said, oh my gosh, I would love to, because one of my passions in what I do is educating. I see probably 16 to 20 patients a day, and an average day includes a 20-minute visit, depending on the need of the patient. But in that 20 minutes, it's not about assessment or putting my hands on the patient necessarily. That part takes the minimum of my time. It's more the education piece. And that's what I really try to focus on, because education is so vital and important. And I really am passionate about that. I feel that education can help drive down the cost of healthcare, which is a huge issue right now in our communities. And both for any age, not just elderly, not just young, not just poor, not rich, it's everybody. So we need to take part in trying to help figure out ways to improve that. So what I'd like to talk about today is just some normal changes as we age. The majority of my patients are probably 50 or older. I do have healthy patient or younger patients in mid-20s to 30s, but probably the majority of my patients are over age 50. So I'm just going to go through some things about normal changes that I want you guys to be able to aware of, whether it's your parents, whether it's yourself, or whether it's somebody you know, things to watch for that are normal. Because one of the questions I have a lot is, well, what should I look for? Or what things are normal, what things are not normal. So first I'm going to go through the normal stuff of what you can expect, so you can all consider yourself getting a free visit today. So one of the things is, as we age, decreased taste and smell. Our taste buds diminish, so things may not taste as well, or flavor may diminish, which can contribute to just not being hungry. Weight loss. As we age, our cells don't rejuvenate. So some weight loss can be normal, and we'll get to what is not normal. I'll talk about that later. Decreased kidney functions. Again, cells don't regenerate like they do after a certain age. And so we'll see that our kidneys don't work as well. And kidneys are important because they help filter our toxins out of our bodies. So that can play a part in all aspects. Let's see if I use the right arrow. There can be increase in urinary frequency as we age. Again, kidneys work harder, they don't filter as well. Decrease in your immune system. We know as we age, the immune system just naturally, again, it has to do with no cell regeneration. So our immune system can become compromised. And that's just in general. It's not if we already have other chronic conditions, such as if we have cancer, or if we have high blood pressure or autoimmune disorders. And we'll talk more about that a little bit later. Decreased appetite. This is normal. It can be a really big frustration for family members if you have an elderly parent, because they don't want to eat as much, and you feel like you got to eat, you got to stay strong. That is important, but we're not burning as many calories as we age. So some decrease in appetite is normal. Loss of bone density, especially for women. As we become postmenopausal, then we lose more bone density, because estrogen is something that plays a part in our body to help maintain our bone density. And so we lose that estrogen as we become postmenopausal. For men, maybe not as much of an issue, but if you have a history of osteoporosis in the family, then your bone density is more likely to be an issue. Weight-bearing exercises is something, and again, I'll talk about how we can avoid some of these things, but weight-bearing exercises can be helpful in preventing bone density loss. Loneliness and loss of friends. Loneliness is a real thing for aging people and populations. It can lead to isolation, it can lead to depression. And then it kind of goes hand in hand with the situational depression and adjustment disorder that I talked about, or that I'll talk about. As we lose people, maybe we have more stressors. We're losing spouses, we're losing parents that are older. And so you can develop a situational depression. It doesn't mean that you're depressed forever. It just means you're going through a really tough time and your moods are down or what have you. And so I can talk a little bit more about that later also. Hearing loss. I've got it, and I'm not 50. So hearing loss is generally, it can be common in just about anybody. Again, if you've had exposure to, machinery or loud noises with work, it can be more common. There is some hereditary factor to hearing loss. My dad had it, my brother has it, and now I have it. So I've noticed even just in the last couple months that my hearing is getting worse. It can lead to isolation, and that's important because, for example, my dad had really bad hearing loss, and he wouldn't go out. He didn't want to talk to people because he couldn't hear, and he was too stubborn to get a hearing aid. So it can lead to isolation. So it's something to be aware of for people. If you're caring for a parent, is it their hearing loss? Are they just not socializing because they can't hear? Can cause medication errors. This is something that's really important to me and I'll talk a little bit about polypharmacy as we go, but if my patients can't hear what I'm saying to them and they just nod their head, they don't know what I'm really telling them, and then they go home and they take the wrong medication. So as far as providers go, we need to be really careful about that. Your balance lessons. So I haven't reached 50 yet, but I can even tell that in the last couple years, my balance is not as good as it was 5 years ago. And that's a normal, our muscles atrophy a little bit, they get weaker, and so our balance isn't as good. And we'll talk more about what we can do to help with that. And so with balance, I'm sorry, I didn't double check that, but so as our balance lessons, we're at more risk for falls. And falls, we know, lead to big bad things, hip fractures, head injuries. And so balance can be really important. If we keep floors clear of rugs and clutter and try to stay active, that can all help with the balance. So just like I said, some things to help age well, and one of them is exercise, stay active, and one of the things I left off of here is diet and sleep. Your diet can be extremely important in your health, and I know I think we have a nutritionist here today that's going to talk a little bit about that. You've probably heard the expression, "You are what you eat," and there's some truth to that. The other thing that I heard the other day that I like to talk about diet is, and I thought this was a really good example. I read somewhere that they said, if you can't plant it or you can't kill it, don't eat it. And that covers our processed foods really well, because we know there's a lot of issues with processed foods. They're high in salt, things like that. And again, the nutritionist can probably talk more about that. And then sleep. I didn't put sleep on here, I apologize. But sleep can be really important, especially if we have depression, or if someone, it helps us be more active during the day. It helps us make better decisions. So sleep can be really vital. And then exercise and stay active. Exercise helps prevent osteoporosis. It's the weight-bearing exercises that I talked about. When we talk about weight-bearing exercises, I'm not talking that you need to go run 5 miles a day. And especially as we age, we know that just physical limitations don't allow for that. But walking, just simple walking, can help keep your bone density. It helps keep your heart healthy. It lowers your blood sugar. And so it helps prevent high blood pressure and depression. It prevents weight gain and maintains muscle mass. Let's see. Practicing preventative medicine with your provider. And this is one of my passions. How many in here have a primary health care provider? Okay, great. One of the things I really emphasize to people is that you really need to have a primary care provider. And the reason for that is that you're gonna help prevent so much more things ahead of, or quicker. You're gonna find things quicker. You're gonna stay healthier longer. Than if you walk into the office and be like, oh, I'm super sick, and now what do we do? So one of the things is make sure you have regular checkups with that provider. This allows us as providers to know your body better and to know what is right and what is wrong. I have had patients that, because I've had them as patients long enough, they can walk into my office and I don't have to touch them. I don't have to look at their chart. I just look at them and I can say, oh, you're sick, because I just know them. So it's really important to have that relationship with your provider. Yearly screenings. Yearly screenings are really important. We talk about mammograms, colonoscopies, and I can answer some questions about these later. But mammograms, colonoscopies, PSAs for men with prostate screening, some vaccines, like the shingles vaccine. So we can talk some more about that later too if you have questions. And then the other thing, and you can't see all of this, and I apologize, but it says do not keep anything from your provider. And the reason I bring this up is I just had a lady that I was taking care of, and she failed to inform me that she went off a pituitary medication, and her liver enzymes went up. And so I'm doing all this workup because I'm like, what in the world's going on? And she had a little bit of history of alcohol use, so we stopped that, and I put her on medication, and like things just kind of snowballed. And then now we've got things figured out, and it's not probably all due to that medication that she didn't tell me she stopped, but I don't know for sure. And so now where do we go? How do we know if that was the cause or how that was not the cause? So just try not to keep anything from your provider. Socialization prevents depression. Use volunteer services to get out. It was great to meet Lorraine because I learned a lot about a lot of volunteer services we have here in Iowa City. I'm not originally from here, so it's been super helpful for me to get involved in all of this. And I'm going to get some really helpful information from my own patients. It helps keep your sense of worth. It's helpful for grief. There's support groups out there for widows and for parents with Alzheimer's, and, there's just a lot of services. So your provider can usually be a good resource for that. Okay, here's one of my passions. Eliminate polypharmacy. One of the things, if you do anything at all, is to make sure you continue to communicate with your provider about your medications. I'm a huge advocate that less is more. Polypharmacy is the use of too many medications that can lead to drug-drug interactions. Ask your provider if you can come off medicines. People ask me all the time, and I'm like, heck yeah, let's look and see what we can get rid of. Now, that's not always going to be the case, but certainly want to look at that. For example, I had a gentleman when I worked just here at IRL, and he came in, and he had just gotten out of the hospital, and he had been admitted with confusion and I think a urinary tract infection. And so he had all these things going on, and then they come in, and he's got like 2 bags of medications. And I'm like, oh boy, this is like you're gonna have to come back 3 more times. But I sat down and I took a whole hour and we went through all his medications. And I eliminated probably at least 5 or 6 medications. Now, mind you, this man had dementia. When he came back for his visit, he was more clear. He was remembering things. His balance was better. So it's really important that you advocate for yourself about your medications and how you're feeling. Another example that I just like to give, I had this lady come in, and she was new to me, and she had really high cholesterol. And I'm a really big advocate. If you don't need it, you don't need it. But if you do need it, we absolutely need it. So I convinced her to switch her medication to Lipitor because it's my choice of statin. She had familial hypercholesteremia, and her age alone is a risk factor for heart disease. So she agreed. Well, what I didn't know, her husband wasn't there with her on that visit. And then she kind of told me, well, I don't think I tolerate the statins real well. And I said, that's good to know. I want to pay attention to that. And so she's like, but I'll try it. She had tried another statin, and she's like, I don't do well with that one. But she didn't think she had tried Lipitor. So we put her on Lipitor. She calls me about a week later, and she's like, Tara, I feel horrible. I'm dizzy. I'm almost falling. She ended up in the ER with a syncopal episode. So I bring her back, and this time her husband comes with her. And he says, she was on that Lipitor before, and she felt just like this. I felt horrible. So, because I scanned her head, she got an EKG in the ER, she got an echocardiogram, I worked her up for all of this stuff, and here it was her Lipitor. Unusual side effect. Have never seen it in my 25 years of medicine. But it's important for me as a provider to listen to the patient, to say, this doesn't work for me. So her husband comes in and said, she had this before. And I'm like, oh my gosh. So we took her off it again, and she was better within a week. Her balance was better, her dizziness. She still had a little bit of dizziness, so I can't say that the Lipitor was the entire cause. But just, again, medications. The more medications, the bigger risk for side effects and reactions. So, and I just recently returned from a conference, and there was a thing about polypharmacy, and one of the things that was interesting is that I can look at a reaction like, let's say, lisinopril and Coumadin. I can look at those, and yes, I can see those reactions between those two drugs. But every drug I add, I can't tell, or we don't necessarily know what's reacting with what and what the side effects with each of those may be, because there's no way to know all of those medication side effects. And one thing I want to talk about when I talk about polypharmacy too, and I get this all the time with patients, is they come in and they say, I don't want to take this medication. It has all these side effects. They gave me the paper from the pharmacy, and it has all these side effects. And you're right, we're required to give you that education. However, don't Google stuff. And if you do Google stuff, make sure it is a legitimate site. Mayo Clinic, University of Iowa. Make sure it has substantial research and education behind it. And then the other thing that I like to talk about medications is that all the side effects that you're going to read, we can't potentially avoid all the side effects. So our job as providers is to say, yes, these are the side effects, but we're pretty sure, both from research and what we have seen in our own patients, that most people don't have those side effects. Check on elderly friends and family. Watch for changes in behavior. Watch for medications that may have been missed. Watch for confusion. When people walk in and say, something's just not right, my heart drops. It's my biggest red flag. I just had a lady that came in 2 weeks ago, and she had left-sided weakness, and she had been seen previously and had some symptoms, but not quite to the extent. Came into me, she said, and had left-sided weakness, had lost some peripheral vision, and she was tearful, and she said, Tara, something's just not right. And so I immediately sent her to the emergency room, and she ended up having a large mass on the back of her brain. So as providers, we need to take those things really seriously. So, and be an advocate for yourself. Confusion. Confusion can be a significant sign of a medical issue. Some people will be like, oh, they're just senile, or, mom's getting senile. Maybe, but if it's an acute confusion, it's more likely related to something else, such as infection. Is it a medication issue? Things like that. Have they taken too much medication? Fever. Fever can be a sign of infection, concern for late stages of infection with the elderly. I have multiple women who come into me and they may not have burning or itching or frequency of urine, but they have a fever and they have a urinary tract infection. And that's one of the things to really watch for in female elderly, is that we lose the estrogen, so it puts us at risk for infection. And some people don't have those first-line symptoms, which we would consider burning or itching or frequency of urine, and they just have a fever. So fever, we need to pay attention to. It's telling us something's going on with the body. And also with that, when we see UTIs in women or even men, you get a prostatitis in a man sometimes. Sepsis can set in very quickly in the elderly too. And I think I talked about sepsis somewhere here, right? Maybe it's after this one. Extreme fatigue or weakness. It could be medication. Could be stroke, could be heart attack. I mean, there's multiple causes, UTIs or electrolyte imbalances. But if it's out of the norm, then those are things that we need to think about. Dizziness. Dizziness, people say I'm lightheaded, I'm dizzy, I'm woozy. So those are really hard for us as providers. But if it's accompanied by balance issues, it can be stroke, it can be a heart attack. Brain tumors. Balance issues can be urinary tract infections. I just had a lady come in yesterday, and her husband's like, I don't know what is wrong with her. She's combative, and she won't get in the car. It took me an hour to get her in the car, and she's confused. Well, she was septic from a urinary tract infection. So, rapid weight loss. With rapid weight loss, we talk about, like, if you've lost 10 pounds in a month, if you're losing weight at a rapid rate, you're not trying to lose weight, that is something that we want to watch for. It can be concerning. Concern for cancer, can be thyroid issues, infection, metabolic disturbances. As we age and the kidneys don't work as well, and we don't want to have to go to the bathroom all the time, we cut back on our water intake. And you can get dehydrated. And so, that can be a concern. Frequency of urine, I kind of touched on this, UTIs, prostatitis. In men, it's difficult to determine if it's just a urinary tract infection or a prostatitis. Sometimes you'll have pain with sitting. And sometimes we have to treat for both. I'm sorry, I don't know if you can see the bottom of my slide, but oops. Many elderly don't have these symptoms and end up septic. This is what I was talking about before, is that by the time they present to us, they are septic, and septic means it's in the bloodstream. We now have a systemic infection that we're trying to deal with. So whereas we could potentially have treated it up front with oral antibiotics, now we're talking about hospitalization, possibly. I had a lady that came to me, and she had a urinary tract infection, and we treated her, and she just wasn't getting better, and she was a nurse, so she knew, and she started running fevers, and she came back to me, and she's like, Tara, something's not right. Pull up her culture, she's resistant to the antibiotics she was on, so we had to switch her antibiotic, but still, she was probably septic or entering septicemia because she was still running fevers, even through some antibiotic courses. And then best free advice I can give is trust yourself. Trust, I always say this to my patients, you know your body better than anybody. So please advocate for yourself, be persistent. If you don't like what your provider's telling you, talk to another provider. We are not always right. And so that's the biggest, and I'll just give you a personal example of that. My son was diagnosed with histiocytosis, and that, long story short, it's a tumor on in the bone. It's a form of cancer. And so we went to the oncologist, and he said, well, he needs chemotherapy and radiation. And I said, I don't think so. I said, have you done the research? And he said, well, yeah. And I said, what I read from Dr. McLean is that he doesn't need chemo and radiation. And he said, well, I'll consult with my friends at St. Jude. And I said, please do so. And so he called me back the next day, and he said, well, no, it's LCH3. He needs chemo and radiation. And I said, well, we're going to Texas. And so I took him to Texas, to the #1 guy in the world, and I paid for it out of pocket. And I got there, and he said, oh, Tara, I can't tell if it's temporal or parietal, because that was all involved in the diagnosis and treatment. And I said, okay. So he said, hold on. He talked to his neuroradiologist, and the neuroradiologist came on, and she said, she's right. It's parietal. Because I said to him, Dr. McLean, we've been saying it's parietal this entire time, and I don't know where the documentation got changed. I don't know who changed the assessment, but I know we've been saying it's parietal. And the neuroradiologist got online, and she said, you're right. It's parietal. And so that was a huge issue in his care. Had it been temporal, he would have needed chemo and radiation. But because of the location, and it was parietal, he needed nothing. And his survival rate, his recurrence rate, dropped from 60 to 70% recurrence to 10. He was entering college, and he got a huge scholarship, so he was able to go on to play baseball and be successful in college, and has a shot at the major leagues. So I just want you guys to know that you know your family's best, you know yourself best, so please advocate for yourselves. It's okay to question, and push for those questions. So, and then, thank you. Are we doing questions now or at the end? Okay, is there any questions for me?
They always stress the importance of foot care.
Yes.
Can you touch on that a little bit?
So foot care is important in everyone, but especially in diabetic patients. If you're diabetic, foot care, if you get sores on the feet or ulcers on the feet or legs, the risk of infection is higher. One of the things we get into with diabetics and foot care is your nail clippings. And so if you don't want just to let anyone clip your nails, because if you clip them too short, then it's really easy to get an infection. You have a lot of bacteria on your feet. I don't like feet, but so it's important to have a podiatrist if you're diabetic, and just watch for signs and symptoms. Ingrown toenails are common, and so those can cause infection. I had a really young girl that came in, and she had the worst ingrown toenails and got a really bad cellulitis from it. And so I'm like, you're going to the podiatrist. But so yeah, foot care is really important also. And good fitting shoes. Shoes are important. They help with balance. They help with pressure points. If you have bad pressure points on your feet, then you're more at risk for sores and calluses and things like that. Anything else? Yes.
You had mentioned some issue with prostatitis.
Uh-huh.
What is prostatitis?
So prostatitis is inflammation of the prostate in men. And so men generally don't have as high a risk of getting like a urinary tract infection because your urethra and things are separate. It's a separate canal. But the prostate is generally enlarges in men over age 50. And so it can, if you do get a urinary tract infection or you get the prostate gets enlarged and inflamed, it's easy to get infected. And oftentimes if a lot of times if I diagnose a man with a urinary tract infection, sometimes I'll have to treat them for, well, I'll draw a PSA to see if that's elevated because that can be an indicator. And if it is, then I definitely treat them for a prostatitis. But sometimes you have to go by symptoms. And so I would put them on like a 10-day course of antibiotic for a urinary tract infection. If those symptoms don't resolve, then I have to extend that and assume that he's got a prostatitis so that we take care of that.
So I just last Friday finished 43 days of beam radiation for prostate cancer,
Yes.
and I'm wondering what should I look for?
What should you watch for?
Yeah.
Obviously, fever, trouble with your stream. You may have trouble with your stream anyway because of the radiation, so it's going to cause some inflammation. But fever is a big one for you. And then trouble with stream. So that's one of the things I ask my men is any issues with stream, trouble with erection, trouble with ejaculation. Those can be symptoms also with the prostate. So it's mainly, or like if you're having dribbling issues or starting or stopping your stream. So, and then some people get pain with sitting, some men get pain with sitting, or some back pain can be too, so.
Thank you.
Mm-hmm. Anything else? Okay, I think I'm done.
Well, thank you, Tara. Next up, we have Natalie Gent. Did I say that right? Gent. Gent. She's a registered dietitian with the Waterfront Hy-Vee. She attained her Bachelor of Science degree in dietetics from Iowa State University in Ames, so we'll forgive her for that. And then she completed her dietetic internship at the University of Iowa, yay, at hospitals and clinics, and she continued at UIHC after her internship and worked as a clinical dietitian serving the adult population. Natalie is a member of the Academy of Nutrition and Dietetics and the Iowa Academy of Nutrition and Dietetics. Natalie is passionate about helping others lead healthier, happier lives, and she believes all food can fit into a healthy diet. I'm in favor of that. And it's if enjoyed in moderation. And so take it away, Natalie. Thank you.
Thank you so much, Lorraine, and thanks for having me today, too. Better lower that a little bit. Okay. So first, Lorraine had asked me to kind of differentiate the difference between registered dietitian and nutritionist. So some dietitians take offense if they are called a nutritionist. Personally, I do not. But these are the difference. So to become a registered dietitian, you do have to obtain a bachelor's degree in dietetics. So that's where I did that at Iowa State. And then after that, you do have to have an accredited internship. And that consists of 1,200 plus hours of actually practicing in the field. So that's what I did at the University of Iowa Hospital. And I rotated through pretty much each unit with the dietitian to kind of learn what they do and address different problems in each clinical state. And then after that, you have to pass your national exam by the Commission of Dietetics and Registration. And then you are required to continue education about 75 credits every 5 years. And then being a registered dietitian is a protected title. As far as the nutritionists go, there are no formal education requirements. You do not need to continue education, and it is not a protected title. So pretty much anyone can call themselves a nutritionist. You actually have to be licensed and registered to be a registered dietitian. So we'll start with a myth. Older age means poor health and disability. So getting older does not automatically mean poor health. So a couple things that we'll talk about today is preventative measures like healthy eating, exercise, and then managing your stress. Those can also all help reduce the risk of chronic diseases when we age. So some aging tips, your calorie needs will decrease as we age, just slightly. So you need about 10% fewer calories per decade from age 50 and onward. Another thing is reducing salt. So try using different herbs and spices for flavors, or Mrs. Dash is also a sodium-free seasoning that you can use instead. And sodium is especially important for individuals with high blood pressure. And then, of course, exercise. Like Tara mentioned, your aerobic exercises improves your heart function, and then your strength training can help your bone density as well and increase your metabolism. Water, touching on that. So as we do age, it is kind of more difficult for us to differentiate our thirst and our hunger cue. So it is important to drink water regularly throughout the day and kind of make sure you're doing that and not only rely on your thirst cue, because sometimes we might not get that as often as we should be drinking. So water can help with digestion. It can help relieve constipation. And then also as we age, and if we are on more medications, it is important to increase the amount of fluids that we're getting as well. And you can obtain different fluids from your foods, like your Jell-O, yogurt, soups, oranges, tomatoes, and a variety of other fruits as well. Some foods that can help reduce joint pain as we age, that's common. Salmon, walnuts, flaxseed, the healthy fats, the omega-3 fats in these do help ease that joint pain and reduce the inflammation as well. Same with extra virgin olive oil. So maybe instead of using butter when we're sauteing vegetables or cooking, we can swap it out for that olive oil for that extra benefit. So going off of my plate, this kind of helps guide our plate and helps us make healthier choices. So it has a nice picture that includes all the different food groups and kind of shows you how to structure your plate for meals. So making at least half of your grains whole. So instead of choosing the white bread, maybe it's that whole wheat bread, or instead of white pasta, doing the whole wheat pasta to get that extra fiber. Varying your vegetables, choosing different vegetables, maybe trying a new one each month just to kind of get a more increased variety of vegetables. And same with fruits. Maybe when they're in season, choosing a different fruit that you've never had, trying to prepare that just to kind of increase the different vitamins and minerals that we're getting from the fruits and vegetables. And it is also important to get your calcium-rich foods. So again, your dairy products, your cheese, your milk, the fortified stuff, those are also all great sources of your calcium. And then your protein, so any of your meats, your beans, legumes, nuts, and seeds as well. So what's for dinner? We don't always have to settle for leftovers or frozen dishes, but that will take time. That will take a little bit time of planning ahead. And so that will be like cooking in bigger batches, freezing in individual portions, and then being able to pull those out when needed, instead of having to always have leftovers or just go for a frozen item. So it's taking a little time to plan ahead, and maybe it's trying a new recipe once a week or once a month to get that inspiration. We'll talk about kind of stocking up the pantry to make for quick and easy additions to your meals. So as far as your pantry goes, so it is good to have canned vegetables, canned fruits, and beans on hand. I will note that when you do vegetables, choose no salt added or lower or reduce sodium, as we get plenty of sodium through the diet, and wherever we can cut it out, it's always a great thing. And same with the fruits. So when you choose fruit, sometimes it'll say canned and heavy syrup, canned and light syrup, or no sugar added. So I do recommend, if available, doing the no sugar added. If not, choosing maybe the lower or the light syrup for a little bit less sugar too. And then, like I talked about briefly, the whole grains, your brown or wild rice, quinoa, barley, and then your whole wheat pasta too. And there are some new vegetable pastas out as well. So there's it's called Banza, and it's made out of chickpeas. So that one has like triple the amount of fiber and way more protein than any of your normal pasta does. So that's a good alternative as well, and it's naturally gluten-free too. As far as the freezer, Buying in bulk, again, if something's on sale, we can buy in bulk and then divide that out into freezer bags and then label those, and then you can pull those out as needed. That will kind of help reduce the waste too, because sometimes we can't go through a whole bag of a bulk item. As far as breads go, I get the question a lot that they can't go through a whole loaf of bread in the amount of time before it expires. So again, cutting that in half and freezing the slices, going through what you can, and then pulling that out as needed. It works really well. I tend to freeze my bread as well because I can't go through a whole loaf before it starts turning green. Same with your meats, your fruits, your whole grains. You can freeze stuff to increase that shelf life, and then again, it kind of can help prevent the waste too. As far as trying one dish meals, these are gonna be meals that kind of contain a bunch of different food groups in one, and it's more like a complete meal, maybe a less work or less sides. So for example, a beef, barley, and vegetable stew, it's gonna have a complete set of your food groups. Same with a chicken, vegetable, and rice casserole. Any casseroles, you can always add extra vegetables in, so it's kind of a good way to bump up your vegetable servings in casseroles. Same with turkey and bean casserole. And then maybe pairing that with a fresh fruit or a canned fruit just to kind of get your fruit in as well. There will be some days that we don't feel like cooking or we don't have the time to cook. So again, plan ahead and make sure we have simple meals to prepare ourselves in the case of us not wanting to cook. So always have leftovers from the other dishes in the week. A frozen meal, I always try to recommend lower than about 600 milligrams of sodium per frozen meal, because some are super loaded with sodium, especially Hungry Man in particular. They usually are about your daily allotted sodium in just that one meal. Your easy steamable, there's the quinoa and brown rice. There's a lot of different steamable packages of vegetables that can make for easy side dishes as well. If you can get them without any sauces, that will help reduce the sodium as well. And then, of course, fresh vegetables and fruit always available for little quick snacks, too. Repurposing your ingredients. So plan your meals based on what you're going to use for the week. So if you do that leftover rotisserie chicken, you can use it for your salad, pizzas, or even make chicken tacos with it. Using your leftover veggies in stews, soups, or even a stir fry, just to kind of reuse those. Don't have to throw them out. And then making extra of your portion of meats. So if it's a nice day and you grill a lot of chicken breasts, you can freeze those and then pull them out as needed, or make a big batch of beef and make some into taco meat, some into spaghetti meat. Whatever it is, just kind of use it to its full potential. And then trying to cook with the ingredients on hand that you have. I think I have some more slides. I'm gonna at the end. I might have sent it an updated PowerPoint. I don't know if this one was it.
Sent an updated PowerPoint.
Okay. They're not on here, but that's okay. I'll go through this and then maybe I saw there's 2 PowerPoints of mine up here. As far as some options that we do offer as a Hy-Vee, so my store is the only one that has a club room in the whole Iowa City market. So we do offer, it's been kind of in the works right now, but the Simple Fix class. So what that looks like is you guys come in and we have different stations. We have everything set up, all the ingredients ready to go, and you actually portion out different individual meals, and then you kind of go grocery shopping at the end and pick up all the frozen meals from the group that they have prepared, and you usually leave with 8 to 10 meals that you can put in the freezer and then pull them out when needed. So we are getting this one back up and running. So if you're interested in this program, don't hesitate to contact me or send me an email, and we can try and get something set up for you. A couple other things Lorraine kind of mentioned is some common drug and food interactions. As far as warfarin and vitamin K, you do kind of want to have a consistent amount of vitamin K that you're eating each day, and you don't want to vary that very much. So some things that have vitamin K is your green leafy vegetables, your kale, collard greens, spinach, broccoli, asparagus, and a variety of others. And then a couple that interact with grapefruit will be your statins and then some blood pressure medications. But always check with your pharmacist because they will know all of your food and drug interactions for any specific medications that you're on. And then a couple other services that we do. So we offer free nutrition store tours. So what that kind of looks like is walking through each aisle, learning how to read nutrition labels, answering any questions that you have about any disease states, just kind of doing more one-on-one interactions actually in the aisle. We do offer individual nutrition consultations. So that's more a one-on-one meeting in my office, talking about any disease states like diabetes education or high blood pressure education, community presentations. We do cooking classes. Tomorrow we have a wine and cheese class that we do every other month with the cheese specialist and the chef. So that's kind of a fun little experience to learn how to make new things. And then we also offer kids events too. And then biometric screenings, we can check for your cholesterol, blood pressure, blood sugar, do some body measurements if you're interested in that. And our lifestyle and weight management program is called Begin, and that is either a 7-week or 10-week course that we kind of talk about different nutrition topics and work through your goals together. Yeah, I think I have a couple more, maybe.
I don't know if this is it.
It might be.
That did not work.
That didn't.
I think they're the same program.
They are?
One's just the slideshow version of it. So
Oh, okay,
yeah,
okay.
the same.
That's okay. I just had a couple other examples of things to stock your pantry with and just a few other slides, which I can send to you too. Any other questions or, yeah?
I have a question on the pasta, because I have
Okay.
diabetes.
1 second. He's gonna bring you the microphone.
Sorry. I have a question on the pasta,
Uh-huh.
because I have diabetes, and I really like pasta.
Sure.
Are like the whole wheat or the vegetable
Mm-hmm.
pastas any better than just the regular
The regular enriched- Yep.
pasta?
So definitely. So your whole wheat will have more fiber, which will kind of help slow the metabolism of the carbs too. And as far as the garbanzo bean pasta that I talked about, the Banza, that one has significantly more fiber and protein than either of them. And so that will also help slow the metabolism of that carb and not spike your blood sugar so much. So that would be a great option as well.
That's good to know.
Yes.
It kind of helps to be able to. It helps to be able to incorporate some of those
yes.
things in a meal.
Right. Especially if you like it.
Yeah. I love it.
Yes, you don't want to have to cut it out. Absolutely.
Thank you.
You bet.
Oh, yeah.
Mm-hmm. Yep. So one quick note on the pasta too. There are spiralized veggie noodles too. You can get them in the frozen section, as well as we have our Hy-Vee shortcuts too that are already prepared. They come in like zucchini, carrot, be a variety of different ways. So then you can add just some pasta sauce. So then that's even lower carb. You still get that fiber. So that's an option as well as.
I've tried some of those.
Did you like it?
Yeah. And it's much easier.
I know it is. Yeah, it's much easier and less time consuming when you just buy it already spiralized. Yeah.
Two quick ones. I've been on statin for years, and I love grapefruit. So I've been ignoring the problem. Is that a problem? I'm still here.
You have been eating grapefruit.
Yes.
What
What do you watch for?
you might be able to answer that a little better than I can.
Well, what the grapefruit does is it actually enhances the the effect of the statin. And so you might be more apt to have myalgias, which is muscle aches and pains.
Okay.
Yeah.
Oh, sorry.
So I was just explaining to him that with grapefruit and the statins, what the grapefruit does is it enhances the statin, so it makes it more potent, if you will. And so you might have more myalgias or muscle aches and pains or joint pains with it. But if it's not bothering you, then you're probably just getting a boost to your statin.
Oh, second question, you didn't mention frozen pizza.
Frozen pizza.
Is that good or bad?
I would just watch the sodium content on that, and maybe the portion size too. So maybe have 1 to 2 slices of that, and then pair it with like a side salad or fresh fruits or vegetables, or even adding some more vegetables to it as well. Same when you're going to like take out pizza, maybe doing a couple slices of that and then having a side dish ready at home to kind of pair the two. Oh, she has one more too.
I just have another question on sodium. What's a good range to stay in? Like, say, for example, like those healthy choice meals. I think they generally run around 250, 300.
Okay.
So what's a good range?
So the recommended daily amount of sodium is about 2,300 milligrams, which is only a teaspoon of salt if we look at it that way. So, like I said, some of the frozen meals have that much, like the Hungry Man, some of them have up to like 2,500 milligrams. So that is our daily limit in one meal. So I do recommend it about 600 to 700 per frozen meal if you're looking at that. So if you say that that one that you were talking about had about 200 to 300, that's acceptable. Yes, absolutely. So and then if we do have high blood pressure, we'll probably limit it to about 1,500 milligrams per day.
Can you talk about the difference in salts? In other words, something like a Himalayan pink salt versus regular. Oh, okay. Talk about the difference in salts.
Yeah.
In other words, between Himalayan pink salt or some other kind of salt that is not just in, I guess, NaCl. Maybe they
Sure.
still are.
So as far as like just sea salt and table salt, they do pretty much have the same sodium amount in them. The sea salt is bigger crystals, so maybe it's kind of thought that you won't use as much as just the regular table salt. As far as the pink Himalayan salt, I do not know much about that. I would assume that they probably have the same roughly amount of sodium, so not necessarily one's better than the other. Just the kind of idea that one's bigger that you might not use as much could be more beneficial in the long term.
I have a question.
Sure.
I love water, but I like to flavor my water.
Absolutely.
Do I negate the benefit of water by putting something in it? I mean, and I'm not talking strawberries or cucumbers. I'm talking the packets of stuff.
So would
Of
you
course.
put like Crystal Light packets in it?
Yes, something like that.
Okay, usually those don't have like any nutrition in them. So it is just like 0 calories or no sugar either. So it's usually just adding the flavor, but not much nutrition to it. So that's okay. It's when we kind of do more of like the pops or the juices that kind of don't add a bunch of nutritional value, but kind of give us a bunch of calories and substitute the place of the water. So what you're doing, the flavored water, that's good. If it gets you to drink more water, that's a good idea.
Good.
Iced tea, sweetened or unsweetened? Okay, that's fine as well. Mm-hmm.
I have a
Yeah.
question. When you said to freeze meals, how long are they good in the freezer for? Like if I bought fresh vegetables and froze them.
Yeah, they usually would have expiration dates, and it kind of depends for like each vegetable. I would probably look that up on how to freeze them too. Some of them you have to blanch them and then freeze them. So I would kind of look that up pending on each vegetable.
County Extension Office has a lot.
Yes, they do. Mm-hmm, absolutely.
I have a question. So,
Yeah.
like on a can of Diet Pepsi, it'll say, 0 sugar, 0 calories, 0. Tell me what it really is.
So it'll have like artificial sweeteners in it to give it the taste, and some natural and artificial coloring too. So depending on your stance on artificial sweeteners, it's kind of up to you which, if you'd rather drink a Diet Coke or a regular Coke. Absolutely, go for it.
I was just going to tell you, it has aspartame.
Yes.
So aspartame, there's research out there that says aspartame can actually be, especially if you're diabetic, that aspartame can be problematic in controlling sugars. So it's not necessarily better for you if you're diabetic,
Right.
because it's still affecting your blood sugars. So really, water is the best. And I just want to make a comment. You mentioned about being a tea-aholic. And tea is okay, but you have to remember that it also has caffeine in it, and caffeine can dehydrate you. So, like, my patients will come in and say, oh, I drink a ton of tea a day. And yes, tea does have water in it, but it also has caffeine. So I always tell my patients, alternate. So do a tea and then do a glass of water. Because dehydration can really be an issue and cause some kidney stuff if you're not hydrated.
Good point on that. Yep.
I just want to make a comment here, and I have trouble getting down enough water, and I was taught a trick to use flavored balsamic vinegars. Harvest Oil and Vinegar over behind New Pioneer. They also have flavored vinegars in, I believe, in Hy-Vee, down at the farmer's market. I know it sounds icky, but they have all these fruit-flavored vinegars, and depending on how strong of a flavor you want, in 8 ounces you can put in anywhere from a teaspoon to a tablespoon, and try it, and it improves the water so much. It has no bad chemicals, no nothing, and so I find myself doing that quite a bit. And it's just really easy to do, and I know at the farmer's market they have samples where you can try it, and also at Harvest Oil and Vinegar they have samples you can try, and you'd be surprised.
That's a great tip. I'll have to try that.
We have time just for one more question. I know Natalie, I just asked, she said she would stick around here and answer some questions afterwards, but if anybody else has a question? All right.
Just have a quick one. With the freezing meals, do you think it's better to put the meal together uncooked and freeze it and cook it as part of the thawing process? Or put together a cooked meal, say your leftovers, and freeze that in that way?
It kind of depends. If we're doing the Simple Fix class at Hy-Vee, it's unprepared. However, if you, like for example, like a casserole, if you cook that and give it to someone as a sympathy gift or something, and then make an extra for yourself, you can cook that and then put it in the freezer. Kind of depends on the meal and what you're doing at that time. But if it is easier for it to be already cooked and then you just thaw it out and put it in the oven, that's fine too.
All right, well, thank you, Natalie.
Yes, thank you.
We do have one more speaker. It's a quick one, though. Dave Coach, the director of Johnson County Public Health, is, I don't even know exactly what you're going to be talking about. Is that terrible? I'm glad you're here to tell us, so.
Not at all. Thank you, Jeff. This will be very brief, and just wanted to take the opportunity. Full disclosure, I'm also an ISU graduate, but my wife and son both got their master's degrees here at Iowa. I will say the campus at Ames is maybe a little bit nicer, but that's just, I'm biased. Yeah, there we go. So from public health, I just wanted to take a couple minutes and share a couple of the services that we have to offer. First, radon. If everybody, I don't know if you're familiar with radon gas. It's a naturally occurring gas. You can't see it, you can't smell it. It's very common in the Midwest of the United States, and a lot of homes, not necessarily even older homes, some of the newer homes can have radon gas. It is the second leading cause of lung cancer. We offer radon testing kits for $8 down at our offices, which is in the Health and Human Services building. And for that $8, it includes the mailing, and it includes the testing, it includes the results and everything, and you get the results in a couple weeks. And so it's a really good idea to test your homes for radon. Another service that we do provide is free HIV and HCV testing. We do have office hours at the Senior Center the second Wednesday from 1 to 3. So actually in about 4 minutes, we'll have staff down there. So if you're interested at all in screening for HIV or HCV, it's completely free. It takes about 20 minutes. So it's a really good idea to do that as well. The hepatitis C screening, there is some criteria. Typically, we're testing adults that have been born between 1945 and 1965. They're at greatest risk for hepatitis C. What else? Vaccinations. Vaccinations, typically, most of our vaccination is for young families and children, but we do offer some vaccinations for adults. However, we're not set up to bill Medicare. We do bill Medicaid and the other MCOs. So just be aware of that. If you have any questions on specific vaccinations, you can call our office. So that's really all that I wanted to share real briefly about Johnson County Public Health. Does anybody have any quick questions?
Are you doing Shingrix vaccines?
We are not. No, we refer to other providers for that. Yeah. So Jeff said it was quick. That's quick. All right. Thank you so much.
Well, thank you. We had some great speakers here today, and I'm glad that had so many questions, but getting close to the end of things here. So I just wanted to bring up a couple of things, try and keep it to our 1 o'clock timeline here. Aging in Place booklets. If you were here for the May event, you probably got one of these. These were really popular, so we were printing out a whole lot more. There's a stack of them over there. These are great books to go over with family members. There's also our Aging in Place checklist that we featured last year in there. Just some really good information to work through with family members. Sorry. No, you're right. Tracy's just anxious. I did just want to say that Tara has her card up on that table as well over there, and Natalie has a lot of information in the back of the room on the table back there. A lot of great information, some of the stuff that she kind of touched on in her presentation, and some additional information how to get in touch with her as well. And yes, this is an important thing, the presentation. No, this is the important thing, the presentation of our drawing here, you know, the $50 Visa gift card, and this was donated by the University of Iowa Community Credit Union along with sponsoring the meal. They donated this card that's going to be going to, I hope it's not yourself because that would really be interesting. Valerie Scher is our winner today. So, well, very close to you. I think it might be rigged, but you can give this to her. One last thing, our next event is in July 10th. It's called Stay Active, What Can You Do? It's going to be at the center, so at the Senior Center, downtown Iowa City. I know people oftentimes say, oh, I hate parking down there. There's a beautiful place to park down there. It is summertime in Iowa City. That means that the students are minimized. So there are parking spaces. There is a free hour of parking. The Senior Center also will be providing an extra hour so that it'll cover the time frame that you're there. There will be a meal again, because we do that every month. So we hope to have many of you join us here in July. We'll be back at this location in August, September, October, second Wednesday of the month, 11:30 to 1. So thank you all for coming. Oh, one other thing here. Come up here, Lorraine. You tell us with this last thing. You're right at the 1 o'clock.
Just wanted to mention, I did bring some brochures. I am a member of Trail of Johnson County and a volunteer. I also serve on the social committee. Trail of Johnson County helps seniors age in place by providing services needed, and you can pretty much request any service. They try to find a volunteer to do this. It is a nonprofit, but there is a slight fee to join. And you can also be an associate member. I'm an affiliate member, so we have lots of programs every month and things. So I have a few of these. If you'd like some more information, please feel free to come up and talk to me afterwards and take a pamphlet. I'll put it back there in the back. So even if you want to volunteer, we're always looking for volunteers as well as members. So thank you.